Good morning, everybody.
Good morning.
Honorable Mrs. Shaliaiti, Minister of Health, Dr. Mrs. Adelit Kassler, Chairperson of World Vision Advisory Council, Honorable Members of Parliament, members of the diplomatic corps, representative of UN agencies and NGOs, children, distinguished guests. I bring you very warm greetings from World Vision, especially from the West Africa regional leader, Dr. Jean-Baptiste Kamati, who is unavoidably absent. We are delighted that you can join us on this auspicious occasion that is taking place during the year in which we are celebrating the 35th anniversary of World Vision's presence in Ghana. Child health now. I just want to pause for a moment and share some thoughts. I went to a village and I met a number of women. One of them we called experience of a colleague a young lady who married at an early age but got pregnant, was expecting a child. But the distance between our village or our home and the health center is about 6-7 kilometers. Probably a relatively short distance, but the road was so bad it was not motorable. The pregnant women in this village will have to go and stay there in that village close to the time of delivery. Because she had complications, she had to go unexpected. She didn't make it. And that created a sad atmosphere in the village. They lost a very energetic lady, both the lady and her baby. The reason I am recalling the story is that this is a common thing, but it needs not happen. And I recently read from the School of Public Health from the University of Ghana data estimating that about 225 women die from pregnancy complication each month while giving birth, while 1 out of 13 Ghanaian babies born die every hour in Ghana. 1 out of 70 Ghanaian women aged between 18 and 49 years will die from pregnancy and childbirth-related causes. This soaring figure to 350 maternal deaths per 100,000 births. The report also noted that 23,000 newborn babies died in 2011. The good news is that together we can end these preventable deaths. And this is why we're here today. World Vision recognizes and celebrates the efforts of the government through the Ministry of Health and the Ghana Health Service in improving maternal and child health in the communities, at the community level, at district and at national level. The policies and actions of the government has resulted in reducing child mortality rates over the years. According to UNICEF 2013, infant mortality reduced from 76 per thousand live births in 1990 to 52 per thousand in 2011, and under 5 mortality reduced from 121 per thousand in 1990 to 78 per thousand. Significant improvements, although a lot more has to be done, and this is why we're here. The free maternal delivery policy the recently launched campaign for the accelerated reduction in maternal mortality in Africa and the establishment of additional midwifery training schools are landmarks in the fight to end preventable deaths. World Vision joins other NGOs in committing ourselves to support these initiatives. World Vision has prioritized the sustained well-being of children, especially the most vulnerable, as a strategic objective for the next 3 years. World Vision aspires, in partnership with the government, to ensure that children enjoy good health and are cared for, protected, and participating in community life. World Vision International has committed about 1.5 billion globally to contribute to reducing preventable deaths among children under 5 years of age. This campaign aims to support and engage the government to speed up efforts to attain Millennium Development Goals 4 and 5, especially to increase access of the poor to quality health services. World Vision Ghana spent over 38 million on health, nutrition, and HIV interventions between 2010 and 2013. Our projected spending in this sector for 2014 is estimated at 9 million. This includes in-kind donations to the Ministry of Health through the Ghana Health Service of about 3.4 million. Our in-kind donation to the ministry for 2012 and 2013 was 5.2 million. To further demonstrate World Vision's commitment to end preventable child death, World Vision will hand over a consignment of drugs worth over 77,000 to the Minister of Health at the end of this ceremony. This assistance from World Vision complements the district health management team's intervention at the district level and is in alignment with the policies and the strategic plans of the government and the district assemblies. Our long-term commitment is to work with the Ministry of Health, Ghana Health Service, and coalitions on health, water, and sanitation, and the media to address the following: increase the availability and access to essential health services and commodities, increase government spending on health in line with the Abuja Declaration, increase access to quality nutrition and health care for mothers and children in the most vulnerable communities. The Child Health Now campaign will join existing coalitions to engage policymakers for increased annual budgetary allocation to the Ministry of Health towards the 15% Abuja target by 2015. This means more money should be available to provide essential and preventable health commodities to vulnerable and rural communities. The Child Health Now campaign will continue to lobby for additional clinics, especially community health programs and services to be constructed for children, families, and rural communities to have access to basic health facilities. This will help to reduce the inequity in access to health service, especially vulnerable communities in the rural areas where most of the people live. Madam Chairperson, honorable ministers, distinguished guests, in less than 2 years from now, the United Nations will assess progress countries have made, including Ghana, to attain Millennium Development Goals. Ghana has to pass the test for the sake of our children. World Vision is therefore committed to continue supporting the people and the government of Ghana towards an improved health status for children. Your presence here signifies your commitment to contribute to this initiative. It is a call to all of us to declare that children cannot continue to die from preventable diseases, and we cannot afford to wait any longer. I believe together we can end preventable deaths. Madam Chairperson, honorable ministers, distinguished guests, and ladies and gentlemen, it is on this note that I, on behalf of World Vision, welcome you to this lunch and look forward to working with you over the coming months to end preventable deaths of children under 5. Thank you very much.